The CDC is reportedly considering a big change in isolation guidelines for people with COVID. Currently, it says that you should isolate for at least 5 days after testing positive. But now the Washington Post reports the agency will propose people can leave their homes if they are fever-free without the aid of medication for 24 hours. So that's similar to the guidance that they give for the flu and other respiratory diseases. So Dr. Lara Jirmanus is joining us now. She's a clinical instructor at Harvard Medical School, a primary care physician, and a member of the Health Watchdog Group, the People's CDC. Thank you so much for joining us, Lara. So I got to admit, when I read this, after so much time, what has it been now, 3 years, 4 years, I felt a little uncertain about the possibility of the guidelines being changed. The CDC hasn't confirmed this report. The agency told us that, and this is a quote, "We will continue to make decisions based on the best evidence and science to keep communities healthy and safe." So what do we know about the science that may lead to a change like this?
Frankly, there's been no change in the science. Current data shows that Omicron variants, which are still producing most disease worldwide, most people continue to be shedding virus for about 9 days with a range of 6 to 11 days. And the more doses of vaccine that you have, younger patients will tend to be infectious for maybe 1 day less than that. Older patients or people with severe disease can shed the virus for a longer time. But there's not been a major change in the science. And to be frank, in the US alone, we've seen over 2,000 deaths a week from COVID since Christmas.
Yeah, and we just showed there was a graphic that came up that said that 20,000 people a week are being hospitalized still to this day in 2024 because of COVID-19. We have a not very high vaccination rate as far as the boosters are concerned in this country, doctor, as you know. So I wonder if this is pressure from corporate America that is suggesting that people perhaps don't need to stay at home 5 days or 9 days. They should probably come back to work after a day if they're not feeling sick.
Is it just about the science if the science hasn't changed?
I mean, the last time that the CDC changed its guidelines, indeed, it was a letter from the Delta CEO asking them to push the guidelines to isolate down from 10 to 5 days. So yes, I think that this is our feeling as well. Is this about what corporate America wants? And furthermore, amid the pandemic, we made a number of really common sense decisions to put people in this country first. There was additional extended paid sick leave. There was additional coverage for health insurance. Since the end of the public health emergency, we've kicked over 9 million people off of Medicaid, including 2 million children. These policies are not making us healthier, and we need a CDC that's going to be making policies that put people first in this country, not billionaires.
Okay, so just to clarify for everyone, the policy has not changed, right?
It's a report from the Washington Post suggesting that they may be considering.
Right. That being said, what advice will you be giving your patients?
I would advise my patients to take measures to try and protect themselves from COVID, because in addition to causing severe illness in older patients, long COVID still exists, and it's still disabling 4 million Americans. Each time you become reinfected with COVID, you can develop long COVID, and the vaccines do help. So get vaccinated, and especially when COVID numbers are up, it's a good idea to wear a mask to protect yourself, and try to avoid multiple infections with COVID, because every time you become reinfected, it actually increases your risk of developing long COVID.
And if you test positive?
If you test positive, I mean, I think most Americans don't want to make their friends and families sick. And, so avoiding contact with other folks, knowing that, you could very likely be contagious for 10 days, possibly even longer. You may want to wait a couple of weeks before visiting, an older grandparent or someone. And take measures to try and avoid sharing the virus with others.
Good advice as always.
Yep.
Dr. Lara Jirmanus, thank you so much. We appreciate it.
Thank you so much.